I was recently asked a question in LinkedIn by a colleague, Benjamin, a security and identity solutions professional. He wanted to know regarding confidentiality, availability, and integrity, the three pillars of cybersecurity, why I think integrity will play a bigger role in the future of healthcare, and if I could explain the security challenges regarding integrity or the Internet of Things, as well as provide a strategy to minimize the risks. Now, this is a great question. I've been talking and consulting to various healthcare groups for about a couple of years now, and I am concerned. They are feeling the pain of cyber attacks, and many are responding in a haphazard way. They are throwing money and headcount at the problem. Overspending can be just as bad as underspending. So I really see it kind of in three different problems. First off, right now, they're chasing yesterday's risks. Data breaches, which is a confidentiality attack, are still the focus and have fueled a budget windfall for security teams. Denial of service attacks, which is availability really, are coming to light and in concern, but the real problem is yet to come. And that's within integrity types of attacks. That's where data is actually just being changed. It's not being stolen, it's not being exposed, it's just being changed. Now, some examples of that. Ransomware, we've all heard of that, and that's really an asset and productivity loss. In hospitals, you run the risk of drug diversion, right? Either in shipments or in facility dispensers, things of that sort. Drugs are always sought after. Medical appliances, they can be manipulated, like pacemakers, implanted defibrillators, and even facility equipment, like medical scanners, IV pumps, and even cameras and microphones in exam rooms. They can all be compromised. Now, on the other end, kind of in the back office, the database manipulation that can happen to change medical records. Now, this can harm people, it can cause embarrassment, and it would be really good for insurance fraud. So that becomes a target. Now, modifying prescriptions, on the other hand, well, again, that's great for theft of the prescriptions, harm to the end users, and all sorts of different misuse. So you have to worry about that. The second problem is overinvestment. And this is a big one. After the 2015 bubble, where healthcare data breaches went wild, the healthcare industry became very scared, but didn't really know what to do. They assumed they should just throw a bucket of money at the problem just to get it, quote, solved. Well, it doesn't really work that way, but you can't blame them too much because 2015 was ugly when it came to healthcare data breaches. And there were dozens and dozens of them. In fact, if you only took the top 10, just the top 10 in 2015, that affected almost 35% of all the United States population. Just in 2015, 35% had their healthcare records exposed. Now, in California, where I live, that number was far higher. In 2015, it was almost 60% of Californians had their healthcare records exposed in 1 year. So you can't really blame them. They were worried about it, but they approached the problem in not so good of a way. Now, we've seen this in the past. In fact, this is exactly what the finance industry did about a decade ago, and they learned many hard lessons. In fact, they realized it takes more than just money to buy security. Now, in both cases, healthcare now and finance back then, these industries, they're rapidly growing their budgets and headcount in the security space, and they're doing it in insane ways. Right? The healthcare industry is doing it now. The finance industry did it before, but learned, even though they are still one of the biggest spenders. And this amount of spending is just not sustainable, which creates problems. Right? Now, I know of large healthcare companies, and I know many of them. One in particular was hiring over 60 security people all at the same time. And it piqued my interest. I kind of looked into it and talked to the recruiters and talked to the different people involved and tried to figure out who they were hiring. And the reality is, they didn't even have an inkling of a long-term strategy. They just wanted to hire as many analysts and engineers as possible. Now, that's not the right way to go about it. And I talked with several CISOs at the time. And most were new to security, so they were just going crazy, trying to hire as many as they could, and they figured, we'll figure it out after we have people in chairs. That doesn't work either. But there was one, and he was a security veteran, so I was very, very interested in talking with him. And I asked him, "What are you thinking?" And he smiled, and he acknowledged that it was a haphazard approach. He fully admitted it. But he also commented that in the healthcare industry, they don't ever get significant investment in security. So in his mind, this was his one and only golden opportunity to get as many resources as possible. So that's what he was trying to do. But here's the problem. Resources without planning will not deliver results and will become obviously wasteful. It will become apparent to executive management very soon. And I have seen this hundreds of times across all sorts of different industries. Right? It is the same equation that plays out again and again and again. And in those situations, it doesn't take very long before budget cuts come in and security gets cut deeply. And this results in the organization being thrown into total disarray. And sometimes it just simply doesn't recover for several years and become an effective force for protecting the digital assets. So the third problem, and this I would say is actually the biggest problem, is the lack of understanding and involvement from the top. And I mean the board, I mean C-level officers. Now, only chasing yesterday's attacks really puts an organization at a severe disadvantage. Data breaches, they still need to be addressed. There's regulatory issues, there's all sorts of requirements around that. And so do denial of service attacks, right? You have to have your website up and your customer portals up and systems up. But integrity attacks, they will eclipse all of those. Breaches and denial of service attacks, at most, they're annoying. They can be a little expensive, that's why people buy insurance and things of that sort. But integrity attacks could be devastating. A new level of financial fraud could be a part of it. But more importantly, life safety of patients are at risk. With all manner of devices, treatments, and infrastructure being connected to networks like Internet of Things devices, they are all at risk, both directly from attackers as well as from upstream dependencies if those things get attacked or data gets altered or compromised. Boards and C-level officers need to understand this. There has to be leadership from the top for cybersecurity to work well. They must take a more strategic approach to cybersecurity, in fact. The financial sector eventually learned and realized that security does not get solved, as it were, right? Rather, the risk must be continually managed. It's something that you live and you deal with on a day-to-day basis. So you can't just throw a bucket of money and say, hey, buy a magic box and make us secure and we'll move on with life. This is a different lifestyle to make sure the digital assets, your customers, your facilities, your equipment and everything remain secure, safe, and private. So what should the healthcare industry do? Well, for starters, from the very top, they need better representation or consultants for cybersecurity. There should either be an expert on the board or at the very least, a trusted advisory group to maintain oversight of security risk directives, assist the CISO and the Chief Privacy Officer in board level and C-level meetings, and those could be semi-annually or quarterly, as well as educate and advocate to the other board members, the ones that are probably not security savvy, when it comes to cyber-related risks. Support from the top is key for healthcare to bypass all those painful and expensive lessons that the financial sector had to suffer through for almost 10 years. There is an opportunity here for healthcare to jump over that, to learn from what the financial sector has already gone through. And all of this is going to come to a head because of the impacts of integrity-based attacks. So I hope that helped. Thanks for listening to my rant. Let me know what your thoughts and what your concerns are. What are your thoughts? Please leave your comments below, and if you found this discussion valuable, please like this video or share it with others so they too may join in on the discussion and benefit from the collective insights. If you are interested in more cybersecurity aspects, follow me on LinkedIn and YouTube for upcoming videos and blogs on cybersecurity.